create a flow for this chapter is start with the standards. If we start with the standards of what the ambulance are to be able to, this section also acts as an accreditation standard. So once we're looking for an accreditation protocol, a guide for accrediting accident and emergencies, the ambulance access in the state, all they need to do is go to this chapter. We can refer them to this chapter. They can see the standard, the infrastructural standard, the setup standard, the equipment standards, and the human resource standards. So we can start with that. I have a reference document which I got from the Fire Department, New York, which is a reputable and long-standing emergency medical service. They have everything well outlined. Yesterday I was in a conversation with my team where we were trying to ascertain what a mass casualty incident is. And once I looked at this document, I saw a clear definition of what they consider it out of their levels of experience, once above 5. But we as Nigerians can say, okay, we have our own standard, as in my opening remark, looking at our own contextual realities. Once it's above the available fleet, you have your facility or your bay, it's a mass casualty accident. If you have one ambulance available and there are 2 patients, I don't think it's too much for you, it's overwhelming. So we need to look at that. It's not what people feel that Nemsas should pay for the services. We're trying to create an economy for that. For transportation, there are criteria that would be social, but it's also an investment opportunity for us to generate funding for EMS in the country. It's like getting funding from this level to make sure we procure more and create more money for. Because when a rich man is sick, you pay. Niger Delta, it's a source of income. We have Bristol helicopters that are not even built for purpose, and the helicopters we are bringing in are built for purpose, right? So they'll be working in those regions, connecting not only the rich to our trauma centers. So we're driving demand for your facility. But what I say is create a VVIP section. Because I know once you land on the trauma center, come down, everything is set up in National Hospital. It's just that I don't think it was being patronized as we need.
So this program, as you know, the National Emergency Medical Service and Ambulance System has been set up to ensure that there is standardized equitable access to emergency medical service for all Nigerians, especially poor and vulnerable. So what we are trying to do now is design a standard operating procedure to ensure uniformity in emergency medical services. We are developing a document that ensures that Nigeria, irrespective of the context, the facility you receive this care, or the state, you know that you will receive a standard form of emergency medical services, which is translatable to improve quality of care and improve prognosis when emergencies present. We understand the problem of the common man is high out-of-pocket spending for health. That is the reason why government has brought about the EMT Gateway Fund, which is part of the Basic Healthcare Provision Fund. Now, funding has been made available. The other side, on the supply side, we are trying to ensure that quality care is made available for the Nigerian populace. And to institute quality care, you must have a standard of how procedures are being taken to manage the patient, such that we guide the health workers, we guide the facilities to provide standard care. So the common man now has a better health outcome when he presents at the health facility, knowing that the capacity of the health worker and the functionality of the health facility is at the level such that if he or her goes in, she comes out healthy.